My name is Annie, and I'm the Executive Director of the McCreary Centre Society. Today I'm calling in from the traditional territories of the Stolo people. Also with me is Maya Pellard from McCreary and Suzanne Vardy, who's the chair of our board and is a clinical counsellor. So our plan for the next hour is just to share data from our mental health report that we published at the end of March. Talk a little bit about a shopping study that we've just done, and then hand over to Suzanne, who will kind of talk about the more practical side of kind of using this data and how we support people. We've been asked to record this by a couple of people who weren't able to attend. So just let you know, like, we can either stop recording before the question things at the end, or if you don't want to be kind of recorded, you could type in the chat box or something like that. But yeah, please let us know if you're not comfortable, but the recording is actually kind of focused on the slides rather than on anybody. And sometimes, because we're using GoToMeeting, what you get is just a very large picture of my head. If that's come up on yours and you would prefer not to look at my head and to look at the slides, you can just minimize that in the top right-hand corner. So the report that we're starting with uses data from primarily the 2018 BC Adolescent Health Survey. So that was pre-COVID, but I think some of the messaging and the correlations and stuff very much hold true today. And we've also got a bit of data at the end that we've collected during the pandemic that we'll finish off with. But if you're not familiar with the Adolescent Health Survey, it's done every 5 years. It's been going since the early 90s, and it's students in public schools aged 12 to 19. The last one, we had over 38,000 young people in grades 7 to 12 who took part in 58 of the 60 school districts, and the project was funded by the government. Somebody's asked if you could have the recording. Absolutely, and you're also welcome to the slides afterwards. As we go through, you'll kind of see that the health picture of non-binary students is generally kind of not as positive as we see for males and females. I just want to kind of put that in the context that non-binary students make up about 2% of this age group. So if we're saying this was the case for 50% of non-binary students, that will be 1% of the entire population. So I'll stop talking now and hand over to Maya, and then I'll come back later, and then we'll hear from Suzanne as well.
All right, thanks, Annie. So this section offers a profile of the mental health of BC youth. So it includes markers of positive mental health, so things like happiness and life satisfaction, as well as challenges to mental health. So things like extreme stress, despair, self-harm, and suicidality. Most BC students rated their mental health as good or excellent, but youth in 2018 were less likely than those in 2013 to rate their mental health positively. There were gender differences, with males the most likely to rate their mental health positively, and also younger students were more likely than older ones to rate their mental health as good or excellent. Like we saw for mental health ratings, students were less likely to feel happy compared to 5 years earlier. And again, males and younger students were the most likely to feel happy. New questions were added to the 2018 survey that asked students about their quality of life. So things like how much they felt their life was going well and that they had a good life. Again, males and younger students were the most likely to feel satisfied with their life, and they were the least likely to wish they had a different life. So that's the category on the far right. Most students reported feeling at least a little bit of stress in the past month, and this included 12% who reported feeling so stressed that they could not function properly. Extreme stress was higher than in previous years, and it went up with age, and it was highest for students aged 16 and older. Non-binary youth that were the most likely to experience this extreme stress, and males were the least likely. 8% of youth reported extreme levels of despair in the past month. Rates of extreme despair, they were similar to 5 years early, but for females, extreme despair was higher than a decade previous, and it remained higher than for males. And as we saw with extreme stress, extreme despair was lowest for younger students. Overall, around 1 in 6 had cut or injured themselves on purpose without trying to kill themselves in the past year. And this was an increase from 2013 for both males and females. And as you can see on the graph, females were twice as likely as males to have self-harmed, and non-binary youth were twice as likely as females to have done so. Youth aged 13 to 15 were the most likely to have self-harmed, and this is a pattern that we've seen in previous survey years as well. The 2018 BCHS asked students about the reasons for having self-harm the last time, and they most commonly reported having done so to calm themselves down. But we did see some gender differences in the reasons young people had self-harmed. So for example, as you can see on the graph, males were the least likely to have done so to calm themselves down, to punish themselves, to stop feeling numb, and to put a stop to suicidal thoughts. And in contrast, it's not on the graph, but males were more likely than females to have self-harmed for a reason that was not among the list of options. So things like boredom, for fun, curiosity, and to avoid doing something that they didn't want to do. Compared to 5 and 10 years earlier, there was an increase in the percentage of youth who had seriously thought about killing themselves in the past year. But there was a decrease over time in the percentage who had attempted suicide. Females were more likely than males to have seriously thought about and attempted suicide. And in 2018, I'm wondering if, Annie, I'm wondering if you can mute the lines.
Yeah, I don't know. I used to be able to. I don't know if I can. Yeah.
All right. Sorry, and so yeah, in 2018, non-binary youth, they were the most likely to have both thought about suicide and attempted suicide in the past year. Around a quarter of youth reported that they had depression, anxiety disorder, post-traumatic stress disorder, or a substance use addiction. And compared to 5 years earlier, youth were more likely to report having each of these conditions. Over half of youth who had a mental health condition reported having a condition that prevented them from doing things that their peers could do. So also among all BC youth, around 1 in 7 missed school in the past month because they were experiencing mental health challenges. In addition, 14% indicated that they were too anxious or depressed to take part in sports or extracurricular activities in the past year. We found that 18% had not accessed mental health services that they felt they needed in the past year. And this, again, was an increase from 2013. Males were the least likely to have missed out on these needed services. And when it came to age, rates of missing out were highest among those 16 to 18 years old. The most commonly reported reasons for not accessing needed mental health services were thinking or hoping the problem would go away and not wanting their parents to know. We found that some groups of youth were at greater risk for missing out on needed mental health services. So these included youth who identified as lesbian, gay, or bisexual, those who had been in government care in the past year, and youth who worked at a paid job during the school year. Also, among youth who missed out on needed services, some youth were more likely to experience specific barriers to accessing services. So for example, young people who worked were more likely than those who didn't work to have missed out because they were too busy to go. Youth who identified as LGB were more likely to have missed out on accessing services because they had a negative prior experience. And rural-based youth were more likely than urban-based ones to have missed out because they were afraid that somebody they knew might see them. So now I'm going to move on to talk about youth who are at risk of poorer mental health. So this includes rating their mental health as poor or excellent, poor or fair as opposed to good or excellent, as well as experiencing things like extreme despair, self-harming, or seriously considering or attempting suicide in the past year. So, as already mentioned, non-binary youth were less likely to report positive mental health, as were transgender youth and those who identified as LGB or who were questioning their sexual orientation. Now, youth who were born in Canada were generally more likely than those born outside of Canada to report poorer mental health. And among youth who were born outside Canada, the longer they had lived in Canada, the more likely they were to report poor mental health. And this is consistent with other research. Housing instability was also associated with poor mental health. So for example, the more times that youth moved in the past year, the more likely they were to have experienced extreme despair in the past month. We also found that poverty and deprivation were linked to poor mental health. This included going to bed hungry because there wasn't enough money for food at home, as well as feeling deprived of things that their peers had, like money for themselves, a smartphone, and clothes to fit in. Youth who actively engaged in online and other activities after their expected bedtime, like chatting or texting or doing their homework, they also reported poor mental health compared to those who did not take part in activities after the time that they were supposed to be asleep. Also, those who had been abused, bullied, or discriminated against were more likely to report poor mental health, including suicide attempts and self-harm. Youth who had a family member or close friend who attempted suicide were more likely to have attempted suicide themselves and to have self-harmed. And traumatic head injuries have been found to have a negative impact on mental health. And this was also the case for students in BC. So the graph here is quite compelling. We see that the more concussions that you've had in the past year, the more likely they were to experience poor mental health. So we see in the last category, attempted suicide, youth who had 4 or more concussions were 7 times as likely to have attempted suicide as youth who had not experienced concussions in the past year. So now I'm going to hand it over to Annie, who's going to talk about protective factors.
Thanks, Maya. So yeah, in this bit, we looked at what was present in the lives of those young people who reported better mental health. So they rated their mental health as good or excellent. They felt they had a good quality of life and they were hopeful for the future. Many of them you would probably expect, you know, young people who got a good night's sleep, engaged in physical activity, had a healthy diet. These things were all associated with more positive mental health, as was feeling connected to the community and to the land and nature. Also, young people who were contributing to their community, so if they were volunteering regularly, taking part in extracurricular activities, they were all more likely to kind of be satisfied with their life and report more positive mental health. It was also really important that when they did those activities, they felt meaningfully engaged and valued within those activities. Also, if young people felt safe in their neighborhood, this was associated with more positive mental health, as was having close in-person friends. We didn't see that same protective factor element for young people who only had online friends, but we did see it for in-person friends. And also not using substances such as alcohol and cannabis, or if young people did use substances, they restricted their use to a couple of times a month. So if they used in moderation, they reported more positive mental health than those who drank more frequently or used more cannabis, those kinds of things. Also, young people who didn't feel time pressure. So young people who felt they had the right amount of time to spend with their family, their friends, on their own and in nature, they were all more likely to report more positive mental health. And young people who had internal strengths, so things like they persevered when things weren't going their way, they had goals that they'd set for themselves, you know, they had plans for post-secondary, or they felt skilled, they felt they were good at something. Those kind of things were all associated with more positive mental health. And we also found that all these factors that promoted positive mental health among young people in general were also effective for those who already had a mental health condition. So for example, young people who had a condition such as depression, anxiety, PTSD, something like that, If they felt that the activities they were involved in were meaningful and their ideas were listened to and valued within those activities, they were more likely to rate their current mental health as good or excellent compared to those who didn't feel as meaningfully involved or valued. So then we looked at the role that relationships plays in supporting young people who are already struggling with their mental health. And I think Suzanne will probably talk more about this shortly. But again, we found that young people with a mental health condition were less likely to report current or recent emotional distress, so extreme stress and despair, self-harm and suicidality. If they had an adult in their family they could turn to if they had a serious problem. Also, if they felt their family understood them. If they had parents or caregivers who knew what they were doing in their free time, so that kind of parental monitoring piece. If they felt connected to school, so this is things like feeling like a part of their school, feeling happy there, feeling safe there, feeling that school staff care about them. Also, if they had an adult outside of family and school in their neighborhood who cared about them. And if they had adults in their life, so people like sports coaches, elders, spiritual advisors, you know, those kind of people, friends, parents even. If they approached those adults for support and found that experience helpful, they were less likely to report recent emotional distress. And also if they had an adult who helped them with tasks, and just to illustrate that there. So you see, for example, young people who had depression, anxiety or something like that, who had an adult who helped them with their homework, making them get into appointments, prepping to get a job or post-secondary, they were all less likely to report extreme despair in the past month compared to young people who didn't have support in these areas. So substance addiction is recognized as kind of a mental health condition, but we wanted to pull it out and look at young people who struggle with both substances and mental health, because we've heard a lot in the work that we've done with young people that it's kind of harder to access services and kind of a lot of times they don't feel well served by the mental health system. So we looked more closely at this group of young people, which was 3% of youth in the overall kind of population who reported having both a mental health condition, so, you know, depression or something, as well as a substance use challenge. And that was defined as well as young people who felt that their substance use has got to a point where they needed help, or they'd been told by a clinician that they had a substance use disorder. And we definitely saw that these young people were more likely to report poorer mental health than those who had exclusively a mental health condition and no substance use challenge. So for example, if you look at the furthest category on the right, they're almost 3 times as likely to have attempted suicide in the past year. And as we've heard anecdotally from young people, those who had both substance use and mental health challenges were more likely to have missed out on accessing the needed mental health services in the past year. So 60% of young people who had both a substance use challenge and a mental health condition had missed out on services that they felt they needed in the past year. And they were also more likely to report certain reasons for missing out. And these included being afraid of what they would be told, as well as having had a previous negative experience when they tried to access services. But many of the factors that we found to support positive mental health among all youth and among those with a mental health condition also worked for those with a co-occurring conditions. So for those who had both mental health and substance use challenges. So there's some examples on the graph there. So young people who were struggling with both their mental health and substance use were more likely to feel hopeful for their future if they took part in extracurricular activities on a regular basis, including things like engaging weekly in informal sports like cycling or skateboarding or things like that. Again, if they felt meaningfully engaged and listened to, felt like a part of the community, felt safe there, felt connected to the land or nature, had close friends, in-person friends, and they could identify something they were good at. They were also less likely to report current emotional distress if they had supportive connections in their lives, so felt close to family, felt connected to school, and had somebody in their neighborhood that they could turn to. So very similar patterns to youth who weren't struggling with substance use challenges as well. So the final question on the survey asked young people if they had any suggestions as to how we could better support young people. Mental health was by far the #1 topic that came up, and you can see some of their suggestions there, including educating adults, caregivers and teachers on how to better support young people, teaching young people more about mental health, including things like what their symptoms might mean, what's the sort of difference between regular anxiety and at the point where it's clinical and you should go and get help, not knowing where to go for help. A lot of young people have told us, often services will advertise themselves, but they don't actually explain what the service is for. So kind of lots of hopefully helpful suggestions like that. So kind of, you're welcome to a copy of the full report. It's available on our website, or we could send you a hard copy if you'd like it. Just to kind of really sum it up though, because we've sort of flown through it briefly, we definitely see how mental health differs by age, by gender, sexual orientation, and life experiences. Also kind of identified those at greatest risk of experiencing mental health challenges, and the need to sort of really focus as well on those young people who are struggling with both substance use and mental health challenges. And then that real importance of supportive relationships and giving young people opportunities to participate in community life and to live a healthy lifestyle. And we definitely see, young people living in poverty and that who don't have those experiences and the ability to access those kind of things, not doing so well in the mental health. So I'm just going to sort of switch gears a little bit and talk about a survey that we've just finished in December. So we were primarily focused on vaping, but I just thought given today we're talking about mental health, it might be interesting. So this is not population level data. This is based on 3,500 surveys that we collected at 3 time points during the pandemic. So we surveyed young people in June, September, and December. And on all 3 surveys, we asked youth if their stress level was higher, lower, or about the same now compared to before the pandemic. And you can see the stair-stepping effect there of the more time that elapsed since the pandemic started, the more likely they were to report higher stress levels now. And we definitely saw if they were more stressed now compared to pre-pandemic, they were more likely to be vaping, which was the purpose of the study. We also asked everybody who completed a survey in September and December how much stress they had experienced within the past 30 days. And they were more likely to report extreme stress in December than they were in September. So again, it was kind of creeping up. And we saw that those who had experienced higher stress levels in the past month were more likely to have vaped recently than those who experienced lower levels of stress. So this real connection between kind of mental health and vaping there. The youth researchers who worked on this project have created a short video which is aimed at students in grade 8 to 12. It's available to share in schools. It comes with facilitator guide or with any sort of groups of young people, and there's some sort of points to stop and have discussion questions. Also explains a bit about some funding that we have through youth action grants. So if young people want to do projects that address mental health or address vaping or pretty much anything else related to health, we have that available, and those are all available. There's also a video from Russell Tybert, who plays for the Whitecaps, talking about vaping. All these are on our website or also on our YouTube channel. There's a bit more detail about the granting, the little logo there, you can find that on our website. And we also have a poster aimed at young people that sort of pulls out the key findings from the mental health report. So that's it from Maya and I. I'm going to hand over to Suzanne now. I'm going to stop sharing my screen and hand over to Suzanne.
Perfect.
You can take it away from here.
Thanks, Annie. Okay, so let's, yes, I think this is going to work. So there. Okay. So just talking a little bit about the sort of now what piece of the information that Annie and Maya have just shared. This is just a wee bit about me. I'm a clinical counselor. I work in a local school district, and that is sort of what gives me this kind of perspective that I'm kind of going to talk to you for about the next 20 minutes from here. So a lot of the information that I'm going to show you at first is taken from the mental health literacy website. It used to be, I think it used to be teenmentalhealth.org. It's now mentalhealthliteracy.org. It's a Canadian website started by Stan Kuchar, who's now a senator, but he is also a doctor of psychology. So a lot of this information is from there, and his programming, his curriculum is a lot of what we're using in schools when we talk to our students about mental health as well now. So it's nice just to sort of have this continuity with hopefully what the youth you are working with, if they're in schools and they're learning this information as well, it will be similar. So to start with a definition, the Canadian Mental Health Association uses this top definition here, that it means striking a balance in all aspects of your life: social, physical, spiritual, economic, and mental. The bottom one is the one from the Mental Health Literacy website. So the important piece that I like about this one is it's not about being happy all the time. Positive mental health is about learning how to cope with the stressors that life throws at us. So you can see at the bottom there, when we experience good mental health, it doesn't mean we're always in a good mood, nor does it prevent the stressors of life from coming our way, but it does help us cope with them so that we can continue to engage with our everyday lives. So it's not about hoping problems will go away. It really is much more about just learning how to sort of cope in a good way with the things that come at us. So just a little bit about the difference between stress and anxiety. And what I'm talking about here is sort of clinical definitions. And just to note that in the McCreary Adolescent Health Survey, it self-reports. So students are not given sort of a definition to begin with. So one of my curiosities is, just because the health survey is done every 5 years, as we begin to have more of these conversations about what is stress, what is anxiety, as we begin to sort of talk a bit more about mental health, will that reflect in any kind of change in sort of the self-reports that we see out as we get sort of, as a society, I think, more clear about our language. So this definition of stress is just any type of change that causes us some sort of strain, either physical, emotional, or psychological. Anxiety, clinical is anxiety, is excessive fear or worry, which causes someone to avoid situations. So it's an actual disturbance in your brain mechanism. So your brain is designed to protect you from harm, and when that is kind of going a bit awry, then that is going to be clinical anxiety. This bottom reference here, Kelly McGonigal, she has a TED Talk on how to make stress your friend. She also has a book that's called The Upside of Stress. Both are excellent. The TED Talk is also a great one to show any youth in your life, and then you can have a conversation about it afterwards. But she talks a lot about how we all experience stress. We all have everyday stress, and it's part of how we cope with it is how we view it, sort of our mindset. It's also important to note that there's different levels of stress. So there is positive everyday stress. There is tolerable stress, which is the kind of stress that we can get through with the support of, if you were, I can say for youth with an adult in our lives, but honestly, tolerable stress for adults is stress we can get through with the support of our friends and family as well. So that's going to look like a move, a loss, kind of any kind of grieving, that kind of stress that we can make it through with support. There's also sort of the level of toxic or chronic stress. That's not the kind of stress that I'm referring to here. Toxic stress is more sort of trauma, and the stress here is sort of the everyday stress, the tolerable stress. And stress is not necessarily, it's a normal part of our lives, and it's not necessarily a bad thing. You wanted me to be a little bit stressed about doing this presentation, so that I spent some time and I put some things together. I mean, it would be quite haphazard maybe, you know, it wouldn't look like this if I didn't experience a little bit of stress. The other important thing to note about stress is that anything that we find meaningful, that gives us purpose, is also something we're going to find stressful. So, for example, our children, if you are a parent, they probably bring you some of the most joy. They also probably bring you some of the most stress. So just to sort of have this awareness that a lot of times in our society, we talk about decreasing stress or getting rid of stress, or stress is bad, and not all stress is bad. Stress, we feel stress about things that bring us meaning, but we also, you know, stress is motivating. It's normal, and we need to feel a little bit about it. This is the stress response. So our brain experiences, you know, we get signals from our body sort of stating that something is happening. We're feeling some stress. Maybe our heart is beating fast. We've got sort of, our stomach is sort of like going in knots a little bit. We feel a little bit flushed. We feel a little bit tense. We have these things that let us know that we're in a little bit of stress. And then we come up with an adaptive solution. So for me, with the example of giving this presentation, I sat down, I spent some time, I looked at what Annie and Maya were going to be talking about. I sort of came up with what I thought might be helpful. My stress level went down a bit. I learned some new skills, you know, probably about time management and that kind of thing. And then my resilience is built. So the next time I'm doing a presentation, I know a little bit more about what I need to do. And so I can kind of make my way around that cycle again with a little bit more knowledge and a few more skills. And that is how we build resilience. What happens with anxiety is there's, you know, we're in some kind of danger. You've got the fire over on the left-hand side of the screen there. Your body sort of begins to send all that sensory information up to your brain. So what you're feeling in your body, what you're smelling, what you're seeing, it all goes up to your brain, and your brain registers danger, danger. Your amygdala sort of starts going off. You get an increase in heart rate. You prepare to do this fight or flee response. What happens with clinical anxiety is that even when there's no danger present, your body is sending signals to your brain that there is danger present. So this is what clinical anxiety looks like. There's either sort of an overreaction to a threat, or there is actually no danger present, and your body still goes through all this signaling. Okay. So clinical anxiety is where it actually interferes with your daily and everyday functioning, where you have excessive worry, where the excessive worry is also hard to control. And there's some physical symptoms that go along, some cognitive symptoms that go along with it as well, that look like feeling fatigued or tired you tire more easily than usual. You might have a hard time focusing. You might have difficulty sleeping. So if you or somebody you know, or children or youth you work with are sort of, you know, you're sort of like, I don't know if this is clinical anxiety or not. It might be just sort of getting into there. That's when it's good to have an appointment with your doctor and do a consultation with either your doctor or a counselor or somebody to sort of have a bit more of a conversation. I don't know quite what the right word is, but sort of the hopeful thing or the helpful thing about clinical anxiety and sort of, you know, somebody who experiences big worry, but it's not sort of entering into that clinical anxiety territory, is that the interventions we use are really incredibly similar. So it's not something that's drastically different. With clinical anxiety, you probably, or you may choose to use medication, as well as sort of a therapeutic approach, which would involve some cognitive behavioral therapy. But if somebody is experiencing sort of big worries, but it's not venturing into clinical, you're still going to be doing sort of some of those cognitive behavioral kind of interventions as well. So I just wanted to point out a little bit of the difference between sort of stress, everyday stress and anxiety, because it's often sort of a question that comes up. But to sort of get more to the point of now what? Like, we have this information from McCreary. We know, especially in a pandemic, that people are experiencing sort of increased sadness, increased worry, increased loneliness. So how do we sort of help our youth learn some coping skills? So the ways that I was going to talk about it here are by modeling and teaching healthy coping. So looking at what we do to get through all this as well. Talking with them a little bit about brain science, increasing our mental health literacy, talking with them about mindset, increasing help-seeking behavior, and then also teaching some strategies about grounding, mindfulness, breathing. There's a lot of sort of strategies out there right now that are easily accessible and that you can sort of access through apps or through different websites or books, all sorts of different ways. I'm just going to tell you about a couple of my favorites. I think the first piece is really important, sort of those pieces that are above the teaching strategies, because I think sometimes we jump straight to teaching strategies. And you can see sort of in the McCreary data, things like when students who are non-binary experience more, they're more likely, I'm trying to read exactly what Annie said, but they're more likely to experience extreme distress. And so that's not just about teaching our non-binary students more coping mechanisms, right? That's also about looking at some of these other things, like how do we increase mental health literacy? How do we change the environment? How do we teach them how to seek behavior, help-seeking behaviors? So there's a little bit of pushback about just teaching self-care right now as well, which I think is really important. So raising, the title of this is Raising Resilient, Socially and Emotionally Wise Children. It's taken from a model that's about teaching these things to children in a classroom. The reason I wanted to include it is because I think it really illustrates how what we do and how we model these things impacts our children and our youth. They learn how to regulate from watching how we do it. They learn about problem-solving skills from watching how we do it. On the positive, the protective factors on that slide that was there was things like healthy eating, getting enough exercise, getting enough sleep. So how do we model those things? As people who are parents, who are interacting with youth, who are in our jobs working with youth and children, how do we model these things? Because they're learning from watching us. It's not okay for me to sort of tell my child that they need a certain amount of sleep and then I'm up late, sort of getting some last minute work done, or I'm sort of skipping out on my exercise. It becomes really important to let them see how we do these things. And also because what we want for them is to grow into healthy adults. And what we do is how we're modeling what a healthy adult is, right? We don't want them to think, okay, you do these things now, but then when you're an adult, it's okay if you don't do all these things. And I know it's incredibly hard to fit all these things in, which is why I also just want to put a caveat in there about, what is your best self in a pandemic? So also bringing this into sort of a little bit of the world we're in today. And none of us might be a sort of too extreme, but most of the people I know are not the self they want to be in the middle of a pandemic. I think we're all a little bit quicker to anger. We're all a little bit more irritable. And our best self in a pandemic is really modeling for the youth in our lives how to just bring ourselves back to regulation again and again and again. So also recognizing that there's a pandemic going on and this is tough right now. Teaching our children about brain science, I think, is really important as well. And one reason for that is because it in part gives the reason why all these, coping things work. Like, why does breathing work? Why are you telling me to sort of feel my feet on the ground? It begins to make sense if they know how the brain works. It also lets them know that their brain is working for the most part the way it's supposed to. There might be sort of pieces we need to tweak and things that we can help them with, but there isn't something wrong with them, that their brain is working the way it's supposed to. So the main pieces I teach youth about when I'm working with them is their amygdala, which is where we sort of experience our big emotions, and their amygdala starts feeling like it's under threat when we go, if you sort of think back to that signaling slide, when we sort of have all those big sensations that are coming up through our body. If we perceive a threat and our amygdala starts going off, it's really hard to think with our prefrontal cortex, which is the part right behind our brain here. It's really hard, right behind our brain. It is our brain. It's right behind our forehead. When our amygdala is going off, and our prefrontal cortex is where we do sort of our higher level thinking, where we can think of consequences, where we can relate to other people, where we can problem solve. And we don't have such good access to that when our amygdala is sort of feeling like it's under threat. So what we're trying to do is settle our amygdala down so that we can access all those strategies we know about in our prefrontal cortex. I can teach somebody all the strategies in the world. They can be brilliant at them, but if they aren't able to sort of settle their amygdala, they don't have access to those strategies when they need them. So we're teaching that to youth. We're teaching them how to sort of begin to recognize when they sort of start to feel a little stressed, a little anxious, maybe something's, they're a little uncomfortable, so that they can then do some of the strategies to sort of settle themselves enough to be able to access their prefrontal cortex. We're also teaching youth that neurons that wire together, fire together. Fire together, wire together. I said that the wrong way around. So the parts of our brain that we pay attention to, those are the parts of our brain where those neural pathways get stronger and stronger and stronger. So the more I practice some of these strategies, the more I practice my breathing, when I'm not in a crisis and I don't need it, the more I have access to it. It's practice. The more I have access to it when I actually do need it. The faster it gets, the stronger it gets. So we're also teaching youth that neurons that fire together, wire together, and that's neuroplasticity. We're also teaching them about mental health literacy. So this is the piece where language becomes really important. So down at the bottom, notice, stress, problem, or disorder. That's when you're sort of feeling relaxed. You're feeling like everything is, I want to say copacetic, like everything is going all right. And then when we're sort of feeling our everyday stress, maybe you're sort of wondering how you're going to finish up what you need to finish up in time to get home to pick up the kids, or you're thinking, okay, I've got this to do and this to do and this to do, and how is it all going to fit together? That's sort of when we're getting into mental distress. So that's sort of our everyday stress that we feel. I would suggest that in a pandemic, we're all kind of living in that area of mental distress. So that's your everyday stress. Your mental health problem is that area where you're experiencing grief, loss, there might be a move, there's been some kind of change, there's been something that's happened where you need the support of other people to get through it. And that's, you can see in the McCreary results, when we are connected, we do better with our mental health. So when we have people that we can go to help us through these times, we do better. That's mental health. Mental disorder, that's where sort of those clinical pieces live. So the clinical anxiety, clinical depression, as sort of ADHD, mental schizophrenia, those kinds of mental disorders, when there's been a disruption in our brain functioning. And that's where we might sort of need medication as well as more intensive therapeutic intervention. Along sort of inside that triangle, we all have mental health. We can all have positive mental health. So we can still be getting enough sleep. We can still be eating well, we can still be exercising, we can still be making sure we have our social connections in place. So they're not, you can have one and not the other. Like, we can have all this together. So you can experience a mental health disorder and you can also have positive mental health. So just let me have a look. I want to make sure that there was nothing else I wanted to say about that one. I think the other thing I wanted to mention was, I had mentioned at the beginning of the slide that language matters. So what we're sort of trying to teach in schools is that depression is not feeling sad. Anxiety is not stress. That clinical anxiety is different than sort of your everyday stress. That clinical depression is different than feeling sad or feeling unhappy. And the reason for that is because our children and youth are more accurately able to tell us what is happening for them. We're more able to sort of get them the supports they need when we sort of make that distinction. It also doesn't minimize for somebody who is experiencing a mental health disorder. If I sort of wake up and I'm sort of in a bad mood one day and I say, oh, I'm just really depressed, that is not what I'm experiencing, is not what somebody who is clinically depressed is experiencing. So the language matters there as well. The Kelly McGonigal video, I think, talks about this really well, about mindset, about how we think about stress also affects our behavior, and how, you know, like how it then the consequences of that stress. So one of her quotes is sort of, before you might have thought of your sweaty palms as a sign of excessive stress. Maybe you saw it as a sign that you weren't handling stress well. Can you choose to rethink these signs as your body and your brain helping you cope? So instead of, for this presentation, me thinking like, oh, I need to sort of take some deep breaths and I need to calm down, which in part I do need to be able to do, to sort of be able to do this well, but I don't want to think that I'm not coping, that I'm not doing well. I need to be able to think, this is my heart beating fast, this is me getting ready, this is my blood is pumping to my brain, like I'm sort of on my toes, here I go, I can do this, I've got this, I know what to do. So her video talks really well, and it's very user-friendly, about how we can kind of change our mindset and how that makes a difference. I like this little video, increasing help-seeking behavior. There you go. There's our little guy. So setting off in the right direction. And increasing help-seeking behavior is sort of increased by decreasing stigma, having these conversations, finding out what the resources are in your local community and in BC, and then making sure you know about them, either by having conversations, by putting out posters. Different youth sort of find different things in different ways. Some look online, some do it through conversations they have, some do it through apps. So we sort of need to, it's an ongoing conversation about what's out there. And do you know what you would do if you had a friend who said they were feeling suicidal? Who would you call? Who would you tell? Would you come to me? Would you go to somebody else? Do you know the community resources that are out there? It's about sort of decreasing that stigma, and we do it by sort of having conversations and letting them know. And there's lots of things, there's lots of newspaper articles, things on social media that you can use as conversation starters. So it's about increasing this help-seeking behavior. At the end, I've got a slide that sort of has some BC-wide resources. So in BC, we have the Crisis Center that has a few different ways that they offer support. One of them is youthinbc.ca, which is an app where you can, or a website where you can actually chat with people. We've got the Foundry, which has an online element. They've got physical buildings. They also, in some communities, but they also have an online element to them as well. We have Kids Help Phone. So all these are places that you want to make sure that the people that you work with, the youth that you work with, know that they can go to. And then all our communities have different services as well, but those are the ones that are BC-wide. These are the quick kind of strategies. Now I'm beginning to sort of talk about strategies that I talk about with the youth that I see. So I talk about the naming 5 things. So one way I explain anxiety as well to youth and sort of even depression is that with anxiety, we're sort of, you know, it's the what ifs, we're sort of thinking into the future, and we kind of can't slow down. We kind of keep on thinking about all the things that might happen. Depression is sort of a bit more ruminating on the past and what happened and what I wish I could change. If we are in the present, if we're sort of focused on the here and now, then I can't be doing either of these 2 things. So naming 5 things is just naming 5 things that I can see right now. So for me, I would say I can see my lamp, I can see my computer, I can see my cup of tea, I can see the carpet, and I can see the light switch on the wall. Then you focus on the sense of hearing, and you name 4 things that you can hear. Then you name 3 things that you can touch. So I sort of talk about that as being, you know, my feet on the ground, or where my clothing is touching me, where I'm sitting in the chair. 2 things you can smell, and 1 thing you can taste. This isn't going to make everything better automatically. This isn't going to mean things that go away, but it is for that moment going to give me that pause, bring me back, and then maybe my mind starts racing again, but I've had that pause. And with practice, that pause can get longer. And I also begin to recognize that feeling, those sensations of stress in my body a bit more. So I can I have more practice at bringing myself back, and I kind of begin to recognize it sooner. Stop is another one, where when you just begin to notice that arousal, when you notice those sensations, you stop, take a breath, and then you just notice, you observe yourself without judgment. It's just this, oh yeah, I can notice my heart's beating faster. I notice my face is feeling kind of flushed. And then the P is purposely pause, or it can be just, I usually use it as proceed. Then you just proceed. Then you're just moving on. And again, it's just building in that pause where you're coming back to the here and now. And both of these things you can do without anybody else noticing. So they're really good tricks to teach to youth, because they don't draw attention to themselves while they're doing these things. Mindfulness, which gets a lot of airtime these days, is to pay attention in a particular way on purpose, in the present moment and without judgment. This is Jon Kabat-Zinn's definition. And anything can be mindful. Brushing your teeth can be mindful if you're paying attention to what you're doing. There's many different ways you can be mindful. So it doesn't necessarily mean sort of taking 20 minutes to sort of do a big practice. And again, it sort of just builds in that pause. And these are some, the mindfulness for teens is a website. It's an excellent resource. It has some audio practices on it, some short ones. It also has teens talking about why mindfulness has been helpful for them. Headspace is an app. There's lots of apps out there. This is just one example. The square breathing is one way to practice breathing, where you just breathe in for a count of 4, hold for a count of 4, breathe out for a count of 4, and hold for a count of 4. And again, there's loads of breathing exercises. So if this one doesn't work for whoever you're working with, for whatever youth you're having a conversation with, or for whoever for yourself even, Google breathing exercises, and there are loads out there. There's a lot of sort of different practices about savoring joy. So this isn't about experiencing happiness all the time, but it's about that neuroplasticity. It's about how do we have brains that are wired to sort of hang on to sort of the things that aren't going very well for us. And that is biological. And there's you can read this Hardwiring for Happiness book. You can Google Rick Hansen and sort of read a bit more about that. But this idea that we can also hardwire our brain to look for the joy. And this is just one way of doing it, but there's lots of other ways of doing it as well. And again, it's just a little bit of a counterbalance. It's a little bit of a kind of a break, a pause in there for a brain. So here are some resources. I can send these to Annie and they can go out if you are interested, or if you just want to take a picture now. I think all of them I have mentioned. The Mindshift app is specifically for anxiety, so it is less like the Headspace is more of an app, and several of them are more about sort of, you know, just breathing when you're sort of feeling a little bit of stress. The Mindshift app is specifically for anxiety, and it's I think it was developed by Anxiety BC, which is now Anxiety Canada, so local as well. So I'm just going to stop my share. And that was the end of what I had. So I hope that sort of gave some information, gave a little bit of context, gave a little bit of the now what. It was really brief on all those things, but again, there's loads of resources out there you can look into any one of those things, and really dig in as well. So thank you.
Thanks ever so much for that, Suzanne. Some great resources there, really. Yeah, thanks. I learned loads there. So we've got about 4 minutes left, I think, 4 or 5 minutes left. So I just wondered if there was like any comments or questions. You can type them in the chat box, or you can just unmute yourself and ask a question or make a comment. I know it's Friday afternoon, and yeah, we're so grateful that people joined us today. So there's a question about how to get copies of the record. That's a great question. I actually don't know. We've never recorded one of these before. This is the first time we've done it. Stephanie, do you know? Steph's recording it. Steph, do you know how we share this?
I think what we could do is put it on our YouTube channel and post the link on our website. So our YouTube channel is at McCreary Center, but I'll post it on our website as well. So you'll be able to find it on the first page where the link to this webinar was.
And yeah, if anybody, like, you could also just email me and I could send you the link as well. I'm at annie@mcs.bc.ca. I'll just pop that in the chat box now. So I think there's probably no more questions. If anybody's typing, we'll just stick around in case you're halfway through typing a question, because there's nothing more frustrating than that, I think. But I just wanted to say again, thank you so much for joining us on Child and Youth Mental Health Day. We really appreciate your time. I know how zoomed out everybody is, and GoToMeeting is often worse, I think. So yeah, thanks ever so much for joining us this afternoon. And if you think of any questions afterwards, you can also email us. Yeah, my details are in the chat box there.